Hello, my name is Jones, and today we are going to look at gangrene. A definition. This is a death or decay of a tissue or organ resulting from poor blood supply and is characterized by skin color turning black. You can also define it as death of a tissue that may result from some inflammatory process that rage a tissue or due to conditions like diabetes where blood supply to some certain parts of the body is cut off. Some points to note with gangrene. Gangrene may either be gas, dry, or wet. Let us understand what is meant when we talk about dry gangrene. This is a tissue death that occurs with no inflammation. It is due to blockage in the arteries supplying blood to that particular organ. Due to this ischemia, the tissue starts to dry, becomes cold, black, and gradually drops off from its attachment to the body. The affected part does not become infected. So this is what we call dry gangrene. The risk factor of dry gangrene include cigarette smoking, diabetes mellitus, arteriosclerosis, and genetic predisposition. When you talk about cigarette smoking, this is due to nicotine in smoke. Blood vessels constrict, depriving a tissue blood oxygen, and death occurs in the tissue that has been deprived of oxygen. Diabetes mellitus. As glucose accumulates within the bloodstream, blood thickens and blood supply to certain body parts is cut off, causing necrosis. Thickened blood causes increased viscosity of blood, making it difficult for blood to pass through small capillaries. Hence, the organ involved will be deprived of the needed oxygen and nutrients, and it will die. Arteriosclerosis. This is due to excessive fats in the blood vessel that block blood to body parts, causing tissue death. So arteriosclerosis, we are looking at conditions that is affecting an artery where there is degeneration. And we are saying it may be due to excessive fat in the blood vessels that will block the supply to the body part, causing the tissue death. Genetic. This has a tendency to run in families where they might have some blood disorder problems, or they may have the issue of diabetes. So there is a genetic predisposition. Let us have a brief pathophysiology of dry gangrene. First, there is tissue and organs surviving and performing their function with very good supply. Following prolonged and excessive smoking, and nicotine here being the predisposing factor because of smoking, it will constrict the blood vessels, depriving certain organs of oxygen and the nutrients that are needed. This then causes the organ to die due to ischemia and starts appearing cold, black, and finally drops off after some months or years. Let us now look at another type of gangrene, which is wet gangrene. Wet gangrene is the death of a tissue that occurs following an infection. It's usually a complication of a wound infection. For instance, someone who had a diabetic ulcer. So it is usually comes as a complication of wound infection. There is a swelling that suddenly stops blood supply from the affected part, causing bacterial infection. Let us have a brief pathophysiology of wet gangrene. Following an untreated infected wound, there is inflammation that causes swelling. Swelling suddenly stops blood supply, decreasing transport of white blood cells, which in turn cause bacteria to multiply in the immediate distant organ. This then worsens the ischemia and will cause tissue death. What would be the signs and symptoms of wet gangrene? The first sign and symptom would be edema related to inflammation, blisters related to fluid accumulation, pain following inflammation, then black skin color following tissue death. Let us look at the third type of gangrene, which is gas gangrene. This is also called myonecrosis. In gas gangrene, tissue death occurs following infection with various organisms. Causative organisms may include Clostridium welchii, Clostridium perfringens, Clostridium septicum, Clostridium histolyticum, or Clostridium noevi. So, pathophysiology of gas gangrene. Following the infection with Clostridium welchii, or an organism that we have just mentioned that thrive in condition with little oxygen, the organ releases toxins in the tissues. The toxins start damaging tissues and producing a gas that also damages the tissue and changes the skin color to black. Alright, so now that is the brief pathophysiology of gas gangrene, which is coming because of Clostridium infection. Now let us look at the management of gangrene. Investigation. History taking. This will show any history of injury to the affected limb or prolonged smoking by the affected client. Physical exam. This will show a black discoloration on the part of the skin that is involved. Wound drainage. This is done for microscopic culture and sensitivity to isolate the causative organism. Then doing MRI or magnetic resonance imaging. This may be done to visualize extent of the damage. X-ray. This may also show the affected internal organ. So these literally are some of the investigations that can be done. Now let us look at the treatment of gangrene. Gangrene needs to be treated before it spread to other areas. So surgery and a range of antibiotics are the primary treatment option for gangrene. In trying to look at it according to the type of gangrene, like dry gangrene, this is due to reduced blood supply. Hence, assessment should be done to determine whether blood supply may be restored by surgery. Pethidine may be given to reduce the pain. So in dry gangrene, we assess if at all surgery will be able to restore blood flow to the affected area. Now in gas or wet gangrene, this needs a quick treatment as it spreads fast through the blood. Debridement should be done surgically to remove all wound-dead tissues. Then antibiotics like metronidazole. For adults, we can have about 200 to 500 milligrams intravenously, 8 hourly for 7 days being given. Then on surgery, amputation in severe cases may be indicated. So there you have it. We've been looking at gangrene, and we defined gangrene as a decay of a tissue or organ that comes due to deprivement in blood. That comes due to deprivement in blood supply, and it is characterized by skin color turning black. We have discussed the types of gangrene, which is dry gangrene, and wet gangrene, and gas gangrene. So those are the types of gangrenes that we have talked about in this lesson. Thank you very much, and keep studying.